Hi, this is David Nevins for Citybiz List, and we have two guests today, Dr. Blair Eig and Dr. Nicole Rochester of the Maryland Patient Safety Center. Welcome.
Thank you.
Thank you very much.
So, Dr. Eig, I'd like to start with you. The Maryland Patient Safety Center, big name, big title. Particularly during these incredibly challenging days with COVID and the like. I know the center's been around for 20 years, but I think it would be worth giving our viewers a bit of a tutorial as to what does the Maryland Patient Safety Center do and how do you work with the community?
Thank you, David. I love talking about the Patient Safety Center. So I am the president and CEO of the Maryland Patient Safety Center, and I've been in that position now for the last 8 months. The Patient Safety Center was created by an act of the Maryland legislature about a little less than 20 years ago. And it was at that time, it was recognized there were a lot of issues with the safety of healthcare delivery that were being identified and needed to be addressed. Healthcare by and large is safe, but not always, and errors do occur. And sometimes those errors can lead to significant consequences or even death, unnecessary deaths, so that we needed to act. And through the Patient Safety Center in Maryland and others in other states, we looked on ways of exploring, researching, educating on safety issues. Our mission is very simple, but honestly, I think it's also very profound. It's keeping Maryland healthcare safe. It's what we do. We've made a lot of progress over the last 2 decades, but there's still a lot more to do. And certainly during this past year, during the pandemic, we've discovered a lot of work to do. So we're happy to be here. We're a small organization, a nonprofit, but we're very, very highly motivated. And we've got a lot of partners in the healthcare world. And it's always just such a wonderful thing to be able to help in this field. And it's why I do this.
Before we get to Dr. Rochester, Dr. Eig, could you just give us some examples of how the Maryland Patient Safety Center interacts with our state's, I guess, our state's hospitals and nursing homes and other healthcare facilities? And at the same time, I know you've had a long distinguished career in medicine, and maybe also share with us how you came to be where you are today.
Well, I'll start briefly with me because I don't mind talking about me sometimes. I am a native Marylander, born and raised in Montgomery County, a proud graduate of the Montgomery County Public School System.
As am I, as you know.
As did you. Spent 10 years in the Boston area for college and medical school. I went to Harvard. And after that, came back home. I was like Dr. Rochester, although before her, I was a resident at Children's National Medical Center in Washington, D.C. I went into primary care practice in pediatrics, actually at the practice that I went to as a child in Silver Spring for 14 years. And then for many reasons, I moved over to the hospital side of healthcare. And I was the chief medical officer for Holy Cross Hospital and Holy Cross Health for 19 years. And in that role, I was immersed in quality and safety issues, which created and increased my passion for those. I also had the great fortune to work with Dr. Rochester there when she ran the pediatric hospitals program for many years. I retired thinking I was going to be fully retired last year, but the Maryland Patient Safety Center found me and appealed to, again, 2 of my passions, my home state and patient safety. And that's why I'm here. I can help us in this new decade and looking at new challenges, and not only now in hospitals, but also moving out into the outpatient world in healthcare and into communities such as what we're doing with Dr. Rochester. In terms of the Patient Safety Center, we have many partners in Maryland. I said we're small, but we work with many in the state, both in the academic field, in community, and also state regulators and government officials. We are very fortunate in Maryland to have incredible healthcare and incredible healthcare institutions. These are nationally and internationally known, like Johns Hopkins and University of Maryland and MedStar. And we partner with them. So I'll give you one example of how we partner with them. We partner with the Johns Hopkins Armstrong Institute of Patient Safety on our Caring for the Caregiver program, which is a national and now international program of support for the resiliency of our embattled healthcare workers, especially during this past year. We do a lot of training and support for institutions so they can support their own staff, which we think is vital. It's both an employment issue, but more importantly, it's a safety issue for both the staff, for the patients, and even for the families associated. So it's a lot of fun, and we're happy to work with Johns Hopkins on that program. We have other programs, for example, that we work with MedStar on. So it's a great place to be.
That's great. I know, I guess if there's any silver lining to this awful COVID, it's all of the positive attention that's been brought to the frontline healthcare worker that you and your colleagues care so much about. Dr. Rochester, you are even newer to the Maryland Patient Safety Center. So give our viewers, please, an introduction of yourself and your background and what your role is and what you hope to accomplish on behalf of the citizens of Maryland.
Sure. Thanks, David. Yes, I am a pediatrician by training, as Dr. Eig shared. I am also a native Marylander. I'm a native resident of Prince George's County Public School. And then I did undergraduate at Johns Hopkins University and then stayed in Baltimore and attended University of Maryland School of Medicine, where I got my medical degree. And then, as Dr. Eig mentioned, I did my pediatric residency training at Children's National Medical Center in Washington, D.C. And then the first 4 years of my medical career, I did outpatient primary care pediatrics and was really drawn to go back to the hospital. And so I became a pediatric hospitalist and had the pleasure of leading the pediatric hospitalist program at Holy Cross for several years. I'm currently an entrepreneur and I'm the CEO of Your GPS Doc, which is a health advocacy and consulting company that focuses on helping patients and their family caregivers navigate the complicated healthcare system. And that transition from practicing clinical medicine and teaching really was drawn out of my experiences caring for my late father and just really seeing healthcare from a completely different perspective. So I have been doing some work on health equity and racism in medicine and systemic racism, health disparities, and was really thrilled when Dr. Eig reached out to me to partner with some of the programs that we're doing with the Maryland Patient Safety Center and the Maryland Hospital Association, specifically addressing health inequities as it relates to COVID, and even more specifically addressing COVID vaccine hesitancy in communities of color, including healthcare workers of color.
So talk a little more, Dr. Rochester, about your work in systematic discrimination in the world of healthcare. I think that's probably not something that many of us think about every single day, but I know it's something that is there and it's important. And I guess I would say it seems like more and more attention is being placed on systematic discrimination throughout our society. Talk a little bit, even specifically, if you would, about how it affects patients and healthcare in the state of Maryland.
Yeah, I think probably the most illustrative example of that really just has to do with health disparities in general. And, I can say when I was a medical student years ago, we were given statistics both locally and nationally about various chronic health conditions like diabetes and hypertension and heart disease and kidney disease. And unfortunately, those disparities were never really put in context. So we would hear that, African Americans had higher rates of diabetes or higher rates of heart disease, or they were more likely to die from specific cancers, but it was never put in the context of the disparities that they face and the systemic racism that they face as well. And so certainly in Maryland, if we look at things like diabetes as an example, Patients who have poor control of their diabetes and therefore are at greater risk of complications are more likely to be patients of color, either African Americans or Latino. We see the same thing with our Native American and indigenous populations. And those disparities really exist throughout the country, and they're mirrored throughout pretty much every state in the United States. And I think the challenge that we all face in healthcare is really beginning to understand the roots of those disparities, understanding that they are not inherent in race. Race is primarily a social construct. There's no gene that makes Black people, more likely to contract a particular illness. And so we have done a lot more work understanding the systemic racism that really underlies those disparities, and understanding, just as an example, that people of color are more likely to live in areas where they don't have access to fresh fruits and vegetables. They don't have access to parks and areas, that safe areas where they can go outside and exercise. Some of the racism that exists within the educational system and within our employment system have led to disparities in income. And so it's all very intricately related, and we're finally starting to pay more close attention to how systemic racism impacts the health of Americans and particularly of people of color. So I would say that, in Maryland, with diabetes, we see that. We've certainly seen that also with COVID. Very early on, I think back in April, when the state first released its data that was segregated by race and ethnicity, we began to see that a higher proportion of individuals with COVID cases, COVID hospitalizations, and even COVID deaths were among communities of color. And we continue to see those trends today.
And I know that a lot of people also find it fascinating that on the one hand, there are tens of thousands of people so anxious to get the vaccination. And yet, on the other hand, particularly in minority communities and communities of color, there's, I guess, a distrust or a reluctance to proceed.
Yeah, that's such a conundrum, and it really pains me and other healthcare professionals. The roots of the mistrust are very deep, and you hear on the media a lot of people talking about the Tuskegee experiment, but the mistrust of Black and Brown individuals really predates even the Tuskegee experiment, and there's just a long history of medical experimentation, even dating back to slavery. We do have the Tuskegee experiment, Henrietta Lacks and her cells being used without her consent. And it just goes on. And, it's important to note that there are present day examples of individuals of color being mistreated by the healthcare system. There's lots of data that shows that people of color are less likely to receive appropriate medications for their pain. They're less likely to receive guideline dictated care for stroke, for kidney disease. And, unfortunately, the list of those things is really long. And so, people are aware of that. And then also, as importantly, or if not perhaps more importantly, every person has their own story. And so it's not just the historical traumas and the historical abuses, but most people of color have their own personal story about something that either happened to them in the context of trying to get healthcare, or something that happened to a close family member or a friend. And so as a result of all of that, there is unfortunately a fairly significant amount of mistrust of the healthcare system. And that has trickled over into this COVID-19 vaccine, along with the mistrust that, Americans expressed in general when the studies were first released, the fears about it being developed too quickly. And when you compound that, the concerns about the safety of the vaccine, long-term side effects, and then you compound that with the mistrust that is inherent and well-earned, I might say, in communities of color, it just leads to, this disaster that we're seeing now, where many are really reluctant.
Quite fascinating. Dr. Eig, you took over the Maryland Patient Safety Center even a bit before COVID, and I know your stewardship there has resulted in the organization being quite, I guess I'd say, responsive and nimble in terms of how it has to work. Talk a little bit, aside from COVID, if you would, about some of the projects and activities of the Maryland Patient Safety Center that are nearest and dearest to your heart?
Well, we many of our projects, which are long-standing or are future-focused, also relate to COVID. So the good news is we can address both.
Okay.
But I already mentioned our Caring for the Caregiver program. We do it in conjunction with Johns Hopkins. Another one of our signature programs is our Clean Collaboratives. We did these in hospitals first, but now we're doing them in nursing homes, and they are infection control training and testing for staff so that they can become not only experts in infection control, but prevent transmission of infections from patients to patients, from patients to staff, from staff to their families. This is vital, and our movement from hospitals into nursing homes has been very specific to the pandemic this past year. We've been in over 20 nursing homes in Maryland this year, and many of them were featured, unfortunately, over the last year on the cover of the Baltimore Sun as having problems. We are there to help them. We will move that into other areas, such as outpatient clinics and even firehouses and emergency medical services. We want everybody to be cleaner and prevent infection transmission. We've talked about the work that we're doing with Dr. Rochester related to COVID vaccine hesitancy in communities of color. But we're also going to work with Dr. Rochester on other issues related to racism in medicine. This is a long, as Dr. Rochester said, this is a very long-standing issue. And it is something that's not going to be fixed overnight, but you need to understand it, you need to listen to the communities, and you need to address the issues so that over time, we can make it better.
I was going to just ask, have you found the representatives, if you will, of the healthcare ecosystem to be to welcome your involvement on behalf of patient safety, that you're a team and you know you're not there to challenge them or question what they do?
I was on the other side of this when I was at Holy Cross working with the Patient Safety Center. Patient Safety Center has always been a remarkably collegial, non-threatening presence. It has always been there to work collaboratively with the hospitals, with the healthcare systems to improve healthcare safety. And I am devoted to keeping that going. So yes, we are finding great cooperation. And even in this early work in the COVID vaccine hesitancy, everybody is thirsty for their knowledge, especially because most of them are having difficulty convincing their own healthcare staff of color to get the vaccine. And we need everybody to be protected. We're not going to get out of this pandemic, this lockdown, this economic turn down unless we can get everybody vaccinated. So that's what, we brought in Dr. Rochester to help us with. It's what we're working with the Maryland Hospital Association on. And I'm real excited about it because, again, from experience, nothing gets fixed overnight, but this is urgent. And you can't do anything about it unless you understand it. You both listen and act. And that's what we're doing.
So
One
true.
thing I forgot to mention, because you did ask, and I will answer, is that two other signature programs that we have are our annual conference, which is a general patient safety conference every spring, where we get over 1,000 attendees last year and this year, virtual. And our medication safety conference, which we do in the fall, smaller conference, but last year was devoted to what we learned about medication safety in COVID. This year's conference is April 29th, and we are concentrating on healing our healers, organizational solutions for safety and well-being. It's again addressing resiliency and burnout in healthcare workers. And our own Dr. Rochester will be speaking about how racial bias has affected healthcare workers in their work, both bias towards them and what they see towards the patients.
That's wonderful. Kudos to both of you. Dr. Eig, how can Citybiz List viewers and readers learn more about your organization?
Well, the best place is to go to our website, marylandpatientsafety.com. And there you will find many resources related to patient safety, our annual conferences, for example, and some of the other work we're doing. We do a lot of education on patient safety, including things I haven't mentioned, like opioids. And we want more involvement from the community as we move forward, because it will help us to spread the word about safety, get patients and families more involved in their care, which can only lead to better outcomes.
And Dr. Rochester, how can our viewers and readers learn more about your work?
They can also go to my website, which is www.yourgpsdoc.com. I'm also on social media. They can search Your GPS Doc on YouTube, Facebook, Instagram, and Twitter.
Thank you both so much for your time. The kudos to you and your colleagues. The Maryland Patient Safety Center is, I know, from my own experience, really helping Marylanders a great deal. And thank you for your efforts in that regard, both of you.
Thank you.
Stay safe.
Thank
Stay
you.
safe.
Thank you.